Chaps, we're talking to Chris Wynne. He's my doctor. I call him a doctor. What are you, Chris? What do you do?
I'm a radiation oncologist. That is, I'm a specialist in the use of radiation treatment, and in your case, it's radiation treatment for the cure of prostate cancer.
You say cure. Does it cure?
Certainly can, and the curability of prostate cancer depends on the stage at the time of diagnosis, and that's influenced by how high the PSA is, what the Gleason score is, how aggressive the tumour is, and what can be found when we examine you.
What does this PSA mean?
Well, PSA is a protein that we can measure in the blood. PSA is made only by prostate cells, and in particular it rises if there is prostate cancer or infection. And in the case of men who have had a biopsy and shown that there's prostate cancer there, then the level of PSA often reflects quite accurately whether the disease is getting better or it's getting worse.
Right. And what's the Gleason score?
Professor Gleason was a pathologist, looked down the microscope, and he rated the aggressiveness of prostate cancer cells by what they looked like. So there are two numbers that make up the Gleason score. It's a scale of 1 to 5, where 5 is the most aggressive, and you add up the two numbers, and the most aggressive type of prostate cancer would score at 5 plus 5, 10.
Right. My doctor in Timaru said I had 40% of cancer in the prostate. What does that mean?
Yes, he may have been talking about what volume of the prostate was occupied by the cancer.
Right.
And they can tell that by how many of the cores on the biopsy needles are involved by cancer cells.
Right. Thanks, Doctor. Now, listen, I'm pretty impressed. I've been coming here now, for 7 weeks?
Yes.
And I'm pretty impressed with the setup you've got here. Can you tell us a little bit about it?
Well, St George's Cancer Care Centre was set up 2.5 years ago. We realised that there were treatments that were not able to be given in Christchurch, and we thought that patients deserve to have the most sophisticated treatments that are available. And in your case, you're having treatment for your prostate cancer using a technique called IMRT, or intensity modulated radiation treatment. Very sophisticated, and you need quite a dedicated band of physicists and radiation therapists to be able to give that accurately. But you're right, it's a lovely building, isn't it? And
Fantastic.
We believe that the environment in which people are treated makes a difference to how they feel about their treatment, and indeed probably to their chance of cure as well.
Great. Hey, listen, Doctor, I'm really impressed with what you've done for me, and I thank you for that. And hopefully this video will be going to many men around the world looking at it. What is the recommendation you'd make to men today when they're looking at prostate cancer?
Get it detected early, get it seen by specialists who know what they're doing, and you have options for treatment that may be surgery, radiation treatment, hormone treatment. Ask to speak to a urologist who's a specialist in operating, and ask to speak to a radiation oncologist who's a specialist in radiation therapy. Get a second opinion about your care and then go for it. Be positive. Most men with prostate cancer can be cured.
That's fantastic news. Thank you very much.
Good. Well done.